Before we use a power pack, we need to make sure that the battery power is adequately charged. To do this, you press the blue button at the side of the battery, pull the battery away and press the test button that is situated underneath. Once you can see a row of green lights, you know that the battery is fully charged. Once we've checked the power is sufficient in the battery, you press the blue button on the top of the power pack and you will hear a flow of air. Wait for all of the lights on the top to turn green and then check that the flow of air is sufficient by attaching the plastic tube and ensure that the orange ball reaches the top of the tube when attached. Once you are happy that the airflow is sufficient, turn off the power pack and you are ready to start putting on your PPE. The next part of the process is to start to apply your PPE. The next part of the process is to apply the power pack around your waist, making sure that any excess belt is tucked away underneath. Push the hose pipe into the power pack and turn and make sure that it's securely fixed. The next step is to apply the hood. You apply the hood by putting your face into the hooded area and ensuring that the elastic is fit nice and snugly underneath your chin. Ensure that your nose is not touching the visor in the hood and the frame on the top fits securely on your head. The buddy will now attach the hose to the back of the hood and turn on the power pack by pressing the blue button. To create more airflow within the hood, press the blue button for a second time. Next, you need to apply a water repellent surgical gown, ensuring that the collar of the hood is tucked with inside the gown. You will need a buddy to help you tie your gown up at the back and ensure that the power pack and the hose are covered by the surgical gown as much as possible. Finally, apply your gloves, ensuring that the cuffs of the gown are tucked with inside the gloves. Once the care of the patient is complete, it's now time to remove your PPE. To remove the gown and gloves, you untie the gown from the tie at the side, cross your arms across your chest and pull at the neck, rolling the gown down inside itself, removing the gloves as you go. Then wash your hands. Your buddy, wearing long-sleeved disposable apron, gloves and a face mask, will clean your hood with a claw clean wipe whilst your hood is in situ. The buddy will unplug the pipe from the back of the hood and turn off the power pack. The hood is to then be removed by putting your hands underneath the collar, underneath the elastic and lifting the hood forwards and back over the back of your head. The hood should then be placed back into the plastic box. You must now wash your hands. The belt is then to be unclipped and handed to the buddy, who will clean down the power pack and the hose with a chlorine wipe. The plastic disposable apron is now to be removed. This can be removed using the same method as a surgical gown, by crossing your arms across your chest, pulling at the neck and rolling down the gown. Hands are to be washed for a final time. The buddy is to remove their PPE following the same process and wash their hands.